I'm Dr. Martin Skie, one of the hand surgeons at University of Toledo, and I'm here to demonstrate the way I was taught to do a wrist exam, and it's worked pretty well for a long time. When I examine a patient, first of all, the most important thing is getting a history, and that should really give you a very good idea of what you should be looking at. I always find it easier to sit across from a patient and then ask them to put their arm up like we're going to arm wrestle. Okay? I was always taught to start from the distal radial ulnar joint and then work to the wrist and kind of go from ulnar to radial across the wrist. So the first thing I do is just check and see the motion of the distal radial ulnar joint. It's important to kind of grab the bones at the distal third of the forearm, not right where you think it's going to hurt. So you can supinate them, pronate them, and then just put some pressure on the joint and rotate back and forth. Generally, patients with triangular fibrocartilage injuries are going to have pain when you fully supinate them, much less so when you pronate them. People with arthritis at that joint will have pain when you rotate through the joint. Then I move up to the ulnar side of the wrist. It's always a good idea on wherever you go, start with the tendon, so I always palpate right along the ECU tendon and the insertion. Same thing on the other side over the FCU tendon. The soft spot right over the tip of the ulnar styloid is where you're going to find tenderness if they have tears or injuries in the triangular fibrocartilage. So the most accurate exam is actually just pressure right in that ulnar recess. Tenderness there is indicative of that. The other thing is you can load on the TFCC or bounce on that to see if that reproduces pain. Okay? I come over to the volar side, and you can easily feel the pisiform. Take the pisiform between your two fingers and just rock that back and forth. Middle-aged people will often have some crepitus there, and pisotriquetral arthritis is a cause of ulnar-sided wrist pain. Next, I work across the ligamentous injuries. So there's two ways to examine injuries to the lunotriquetral joint. I think the easiest is the shear test, and to perform that, you put a thumb on the back of the wrist over the lunate, one thumb volarly over the pisiform, and then just push, okay? And you really can't feel much, but you're creating some motion at that joint, and all you really want to do is reproduce their pain. The other way to evaluate that joint is with triquetral ballottement. Put your thumb on the pisiform, finger on the triquetrum, and just try to move it back and forth. And again, reproduce their pain and create some motion. Across the scapholunate joint, you can have tenderness right there. There's two tests to evaluate the scaphoid and the lunate. I think the easiest is the scaphoid shift. To do that, you fully radially deviate your wrist. That's going to flex your scaphoid. You can easily feel the distal pole of the scaphoid. Put your thumb on the distal pole, stabilize the radius, and then all you're going to do is push from volar to dorsal. Okay? What you want to feel is the proximal pole of the scaphoid sliding off the back of the distal radius. Okay? The other way to do that is the Watson test. I think that's more difficult. The way you perform a Watson test is by placing your thumb on the volar radial aspect of the wrist over the distal pole of the scaphoid. And then as you go from ulnar deviation to radial deviation, your thumb is preventing the scaphoid from flexing and forcing the proximal pole of the scaphoid out dorsally. I think that's more difficult to feel, especially starting out, so the scaphoid shifts a little bit easier. Okay? Again, on the radial side of the wrist, you have your wrist extensor tendons. You can palpate along those. You have the tendons of the first extensor compartment. You have your anatomic snuff box where you'll have tenderness if there's a scaphoid fracture. And then tenderness at the base of the thumb, right? That's a common problem. Volarly, it would be the FCR tendon. Okay? Lastly, with the wrist bones, you have the midcarpal shift or midcarpal instability. Midcarpal problems tend to be common in younger, ligamenously lax patients, especially during athletic activities. And what happens is, as you take your wrist and go from radial to ulnar, the entire proximal row of bones is going from flexion to dorsiflexion. Okay? To do a mid-carpal shift, I need to stabilize the distal forearm. I need to supinate through the wrist, put just a little bit of pressure on it, and then go from radial to ulnar. Okay? That's putting the wrist in a slightly abnormal position, and then when you release the pressure or go dorsal, there's a little bit of a shift or a clunk. In some patients, it's very dramatic. And Jeff, here you can see it a little bit. Okay? People who are really loose will have what they call a catch-up clunk. And that's where they can literally just make a fist and go from ulnar to radial or back and forth. And you will actually see the carpals shift as they do that. Okay? There are a couple specific tests for tendinitis. If we start radially, the first extensor compartment is the classic Finkelstein test. Have the patient grab their thumb and ulnar deviate. All you're doing is stretching those tendons that are irritated. You do have to be careful if you're dealing with patients that are 50 or older. People with CMC joint arthritis are also going to have pain if you do this maneuver. Okay? But tenderness that's reproduced with this and right over the first extensor compartment, decoy veins. Second extensor compartment, you can stretch those simply by extending the elbow and flexing the wrist. Fourth extensor compartment, have them make a fist, flex the wrist. Sixth extensor compartment, you can stretch them by simply flexing and ulnar deviating, or doing the ECU synergy test. Can you spread your fingers apart? To do that, you're going to put pressure on the thumb and the ring finger. That makes them stabilize, and then they will have tenderness when you palpate right over the ECU tendon at the sixth compartment. That's the best test to differentiate ECU tendinitis from triangular fiber cartilage injuries. On the volar side, FCU and ECU, both of them will have pain if you stretch those tendons or if you actively resist. Can you push against me? And then palpate along the course of the tendon. I think that was the best, simplest way to go through a wrist exam. Hopefully that helps you.